Welcome to Health on the Hill. I'm Agnes Carey. The Obama administration's decision to postpone by 1 year a requirement that companies with 50 or more workers offer health insurance or pay a fine has brought heavy criticism from Republicans on Capitol Hill. Today, members of the House Ways and Means Health Subcommittee examined the administration's decision to postpone the health law's employer mandate. With us to discuss the hearing is Paige Winfield Cunningham of Politico Pro. Thanks for joining us.
I'm glad to be here.
Paige, you and I have covered a lot of these hearings on the Affordable Care Act, which is also known as the ACA. And today I heard a lot of what I've heard at some of those other hearings. Democrats defending the law, Republicans attacking it. What was new?
Well, you're absolutely right. We've heard the same arguments over and over again from Republicans. But I think what was new today was they do have a new piece of ammunition to throw at the same target. And that is now that the administration is giving employers another year to comply with the law, Republicans are trying to make the case that this is really unfair to individuals and families who are also going to be faced with this mandate. And they're saying, if you're going to treat one person, you're going to give one party this special treatment, you really should apply it across the board to everyone. But they're really trying to use that argument to kind of aim at the same thing, and that is the overall health care law. So you're hearing a lot of the same arguments that the law is not ready, that the administration is saying it will be, but it won't. Other parts of the law have already been repealed. The exchanges aren't all rolling out as the administration thought, with some states refusing to run them themselves. So they're trying to feed all of this into that broader argument that the health care law is just fundamentally flawed.
What did Democrats say about this delay in the employer mandate? Do they support it?
Yeah, I mean, absolutely. They're trying to make the case that the administration is just listening to the business community, which has been very vocal over the last year, saying that they need more time, they need more details about the regulations, that they're not going to be ready on January 1st. So Democrats are saying, hey, the administration is doing its best job to roll out a really big, complicated law. They're just listening and being attentive. You also saw Ranking Member Jim McDermott talk a lot about how this is really just one small piece of the law. It's not really going to affect that many people. There's a small portion of folks that were expected to get employer-sponsored coverage next year. But in the broad scheme of things, this is just one piece of the puzzle. And so they're saying Republicans are really blowing this up too much.
This isn't the only hearing on this subject. Kevin Brady, who heads the Ways and Means Health Subcommittee, said they're going to have another hearing next week. They'll have a witness from Treasury there to discuss the delay. We know there's other Hill committees with hearings on the horizon. How might those be different? What might we learn in addition at those hearings?
Well, I think Republicans are really trying to capitalize on this opportunity before the August recess. So you're right, they're rolling out a lot of hearings. We may even see one come out of the Education and the Workforce Committee, which has a little bit of jurisdiction. I think they're trying to really drill down and find out why the administration made this decision, what was going on behind the scenes. But mostly they really, I think, want to call the administration out and make them publicly talk about this and really put them kind of on the hot seat and force them to answer questions about this. There have been some suggestions by Republicans that the administration didn't have the legal authority to do this. So that's probably going to be part of the discussions as well.
So you mentioned this is now in the political arena as well. House Speaker John Boehner has promised additional votes on the ACA. Tell us about those.
It is going to be a really busy month. There could be 3 votes this month before they leave for recess. One would be to also delay the mandate for individuals and families. And that could possibly be paired with another bill that would basically do what the administration has already done, which is delay the employer mandate. The Republicans want to force Democrats to vote on that for delaying it for employers, and then hold a vote on the individuals and families to kind of call them out that way. And then a third vote would be on a bill sponsored by Congressman Tom Price, and that would be to basically ban the IRS from doing anything to implement the law. So we could see 3 votes on that coming down the pipeline very soon.
Who does this bring political leverage to in the midterms? The Republicans, the Democrats, both?
It's a little hard to say at this point. Probably Republicans, because they've been trying to make a case all along that this law was not going to be ready in time, and here's like a piece of evidence that they can point to. I guess that thing working in favor for Democrats is the business community had been very, very vocal about wanting a delay and wanting some changes. This decision is allowing the administration to say, hey, we're listening to you. We're attentive to, what the stakeholders are saying. So we'll see how it plays out, but I certainly think it's not going to be, Republicans are going to keep this on the forefront as much as they can.
All right, well, thank you so much, Paige Winfield Cunningham of Politico Pro.
Thank you.